A recent study by the CDC shows teen girls are experiencing the highest levels of sadness and sexual violence in a decade. The data, staggering. At least 1 in 10 high school girls said that they have at some point been forced to have sex, a 27% rise since 2021. Nearly a third of girls said they seriously considered attempting suicide, up 60% since 2011. Well, joining us now to talk more about solutions is Dr. Kerry Peterson, an associate professor and mental health specialist at the CU College of Nursing. Doctor, thank you so much for being with us today. We appreciate it.
Thanks for having me.
Yeah, such a tough topic to talk about. Firstly, let's talk about this increase. What do you think is contributing to this?
Well, teens certainly face a variety of different challenges, and there's been lots of different factors proposed as why we're facing this mental health crisis for our nation's youth. Things such as social media, bullying, school violence, certainly the impacts of the pandemic. These are all things being investigated, but we do know that there has been a significant increase, particularly among teen girls, at twice the rates of what we're seeing for boys as far as feelings of sadness, hopelessness, and as you pointed out, that the very detrimental statistic around the sexual violence is very concerning.
Mm-hmm. Any information that you've been able to gather that relates to that issue in particular?
As far as the sexual violence kind of being on the rise, certainly, yeah, as you pointed out, more than 20% increase even from the past year. That is very concerning, and that we really need to make some efforts to address that issue in particular, and teaching more healthy relationship skills in school and having some more interventions for how to prevent violence across the board, and in particular sexual violence for our nation's young females is very important.
I have a 12-year-old at home, so how can parents like myself, what can we do to make sure that we open these doors of communication with our children?
That is the key, to keep the communication open and being non-judgmental in our approach when our children come to us and talk with us about what's concerning them, really listening about what their concerns are and how we can address it. Also, parents need to be able to look for changes, so any significant change from their baseline, aside from the typical variations in teen moods that sometimes go up and down, to really make sure we're looking if there's changes in sleep, appetite, withdrawing, social isolation. Another thing this CDC study found was nearly 1 in 3 teen girls have seriously considered suicide. So it's very important to look when we're noticing these kind of changes and to reach out and get help and support for our teens.
Let's talk about those resources that are available to our young people. Where can they go for help whenever they realize that they need somebody to talk to?
Yeah, so if you know a teen in crisis, definitely the 988 suicide crisis lifeline is important to call that. But really getting people involved. We know getting teens socially connected, getting schools involved, those can be protective factors. There's also lots of information on the CDC website, and locally here at the Children's Hospital Colorado at their Mental Health Institute has some additional resources and referrals as well.
All right, Dr. Peterson, thank you so much for your time today. We appreciate it.
Thank you.